Hello, welcome to the Columbus Metropolitan Club. I'm Mindy Wright, a member of CMC's Board of Trustees, and I'm the director of the nonprofit Ohio Education Alliance. It's really good to see such a big crowd today. Today, CMC and Ohio Health present Our Healthy Community, Denial Ohio, an update on the opioid crisis. This series is sponsored by Ohio Health and Mount Carmel Health System, and there's additional support for this forum today from Cardinal Health. Each of our sponsors is represented here by many friends and associates, so won't you please help me thank them? Opioids, addiction, crisis, words don't begin to describe their tremendous cost to our nation. In lives lost, families torn apart, impacts to first responders, teachers, social workers, lost productivity. And yet in the face of all the trauma, it is in our nature to work towards solutions. So today, let's hear from experts. Please welcome President and CEO of Maryhaven Incorporated, Sean Holt, CEO of the Alcohol, Drug, and Mental Health Board of Franklin County, David Royer, Columbus firefighter Tiffany Page, and our host, President of the Nationwide Foundation, Chad Jester. Chad, the podium's yours.
Great. Thank you, Mindy, and thank you, everyone, for being here today. Echo the appreciation we have for our three sponsors for today's forum. Just in a few minutes of conversation with David, Tiffany, and Sean, we had such a rich dialogue around this crisis and what's happening in our community, and unfortunately, not just in Columbus, but around the state and around the country, that we're going to jump directly into the conversation. We're thrilled that Tiffany is here representing one of the many fine individuals who are front line on this issue. So Tiffany is not only a Columbus firefighter, but provides EMS services to folks throughout the community. Tiffany, let's start with you. Why don't you tell us a little bit about your work, what you're experiencing on a day-to-day basis, and if you wouldn't mind sharing some of the stories that you did with us at the table over lunch.
Sure. On a day-to-day basis, I work on the medic, mostly on the west side, and I'm probably reviving somebody on average at least once a day. Maybe not every day, but when you average it out, it's probably at least once a day. This last week was a pretty busy week. We actually had a gentleman that we revived one 24-hour shift when we went back the next 24-hour shift, which would have been 3 days later, and ended up getting both him and his daughter, who was using heroin with him, into treatment that night.
Wow. So the father and the daughter,
yes.
Can you tell us a little bit more about the drugs that you encounter in the household and how these overdoses are occurring?
Well, for the, excuse me, for the father, he started with the pain medication from surgeries, back surgery, leg surgery. He's actually on disability at this point, and it just wasn't relieving his pain any longer. I think that the story from the daughter was she had gotten into father's pain medication and then fell into the heroin, and then the two intersected.
Wow. So an indication of what's happening in our community through the eyes of Tiffany and her colleagues frontline. So Tiffany, sticking with the father and daughter,
yes.
Did they stay in the household once you used the, I assume, Narcan or naloxone, or did you transport them to the emergency room, or where?
They actually, the first evening he was transported to the ER, and the second evening we were able to get him and his daughter into the New Maryhaven facility on South High Street, and they were able to start treatment almost immediately.
And is it frequent that you might be at the same address on a regular basis?
Yes, very much so. I've got some people that I know by first name.
Wow. Well, thank you.
Yes.
We'll circle back to Tiffany with some more eye-opening, what's happening in our community. But I was really struck by a father-daughter and the entanglement of legal and illicit drugs within one household and what it led to for this father and daughter, not just on one occurrence, but sounds like recurring opportunity. So Sean, Mary Haven is frontline as well, doing treatment and recovery, and Tiffany actually mentioned the stabilization center. Can you paint the picture for what's happening with your work?
Yeah, the story that Tiffany gives is our daily reality. Just 6 months ago, we opened the stabilization center on South High, and we have seen 900 patients come through in just 6 months. And so that's the daily reality of what we're dealing with. I think the negative thing that, alludes to Tiffany's story is that the opiate use is so pervasive in our community. A lot of the times, even though we're putting in good, strong support systems and providing excellent treatment, a lot of times these folks are leaving our facility and entering into the same community, which is a no-win situation.
So Sean, tell us a little bit about from opening to today, if you've been at capacity, if you're turning people away, just what the dynamics are of the need.
Fortunately, we've not had to turn anyone away, which is really, really good. It's been well documented in the newspapers and the news. Before January, when we opened, the lack of treatment beds was a really negative spot on the whole treatment, facility. And so we, like I said, 900 people have come through. Now, this past weekend, for whatever reason, we almost hit capacity. And so that's really, really scary. But it also, we like to think of it as, we've had an opportunity to save 900 lives potentially. And there's always room for expansion. And so we're looking at those things as well.
So Tiffany, Sean, what insights might you have on why we spiked up this past weekend? Does that happen on a regular basis or periodically?
Yeah, I mean, we were just talking about the fact that we'll see a slow period, which we had seen, I felt, for a couple of weeks, almost a month, and then all of a sudden, it just started spiking up 3 and 4 a day again. And myself, speaking with the patients, trying to figure out what was going on, it just seemed like something new had hit the streets, or as what we like to say, a shipment came in from somewhere, and everybody was hungry and ready.
The only thing I would add is that we do see these spikes, and I think we do a really good job of announcing when spikes are happening. It was an eye-opener for me. I actually got an opportunity to sit at a forum with patients who were addicts, who were in recovery, and kind of said, that's nice that you guys send out these alerts, but we want to tell you, when you send those alerts out, we're looking for those houses. We want to get that high. We're seeking where that fentanyl potentially came from. So it's an issue that we deal with all the time. All the time.
So recently, Sean, David, and I were at the stabilization center, and we had a chance to interact with a few of the clients that Sean and his team are supporting. And I was really struck, Sean, by 2 of the individuals coming up to us and saying, thank you for supporting them and for giving them an opportunity to change their lives, become clean. I think they recognized it's a long road in front of them. Would that be indicative of the clients you're serving?
It is. And we realize, I think what sets Mary Haven apart is we are there with them for the long term. We realize that this isn't going to be a 1 or 2 visit, a visit to our place. And so, we're hanging in there with them. And like I said, we have an opportunity to to provide immediate access to treatment, which I think is saving people's lives.
Great. David, let's go big picture. What's happening from an Adam H standpoint? What trends are you seeing? Do you think that we're on top of this issue as a community, or we're still in the trenches fighting these battles each and every day?
I really think that in many levels, we still struggle with the day-to-day, repeating cycle of overdoses and families being affected, losing people. I mean, we lost over 500 individuals last year in 2017 to overdose death here in Franklin County. So that cycle continues, unfortunately, but it has gone down a little bit. And I think that it's really a tribute to a community awareness and specific intervention strategies about the use of naloxone. The problem about the naloxone administration is that when people first started overdosing, the vast majority wanted to be transported to an emergency facility. What we're starting to see now are more and more people are comfortable, if you will, with playing roulette on the naloxone, where they decide, I don't want to be transported to the MASC, or I don't want to be transported to the ED. They're willing to take that risk that somebody will be there at that moment in time. So while we make progress on the death rate, the risk behaviors continue, and I think they're actually growing in many ways.
I would agree with that.
Yeah. From a community perspective, I think there's a couple things that are really positive. One, that obviously the community has tremendous awareness, and that's across Ohio, across this nation. I think one of the challenges for us is to start to communicate not about the state of the problem, but the state of the solutions. What are the actions that we're taking to try to address this? We tried to do that here in Franklin County with an opioid action plan that was really built around a couple pillars. One was about treatment and supports. One was about health care and risk reduction, and then obviously working with our first responders to increasing the intervention. The final piece, and it really isn't final, it's just it's the beginning of this piece, is about community education and prevention. There's two things. We can respond in many ways. What the ADAM-H system does, along with Sean and first responders, is we're dealing with the active risk of casualties. But we also have to have a community-based strategy that educates our community about the risk to opiate use, knowing that the vast majority of people that get into heroin addiction actually start through opiate prescription drugs. And so that's an important piece that really needs to be focused on as the community. So I think we're making good progress in a lot of areas.
Great. David, as part of the opiate plan from last year, so it's been about a year in action, can you update us on the progress of the plan and then specifically talk about where we're headed with the prevention and awareness campaign?
You know, as it relates to the prevention and awareness campaign, we started first having some conversations about what does that need to look like, and how do we begin to develop a strategy that we think makes sense. We started actually having conversations with Nationwide Foundation, and they were interested in beginning to look at how can we be helpful. And rather than just kind of dive in with a standard approach, in partnership with Nationwide Foundation, we actually said, let's take a look at what's out there. And credit to the CEO of Nationwide and the leadership team, the board. They wanted to treat this initiative just like they would any other initiative that Nationwide would undertake from a communications, marketing, and branding strategy. So they brought in their best people. I think one of the things that we quickly did as part of that survey process was we began to understand that there were a lot of campaigns out there across the nation, but none really had focused in a very specific space. And that's what we tried to do through what really was about a 6-7 month conversation and research about what space do we need to think about attacking this problem in an education and a preventative context.
So just a few additive comments. This is really under ADAM-H's leadership, but David is on point that Nationwide Foundation, and many other community partners have weighed in to say we want to be part of an education and awareness campaign, which has led to the Denial Ohio effort. So at your place setting is a listing today of the Alliance members tied to the campaign. These are local and statewide organizations, and I was speaking with a few of the members who are in the room today. We're adding more to this list even today. So it's been pretty amazing how organizations in our community and throughout the state of Ohio want to be part of something positive tied to education and prevention. So David, I'll turn back to you on how we're tracking data. So it has struck me that we talk about overdose deaths quite a bit. That's a data point, right? More than 500 people last year just in Franklin County alone. Tiffany, I think about the number of runs you and your colleagues are on, the number of Narcan and naloxone administrations. As you go back up, my question, David, Tiffany, Sean, would be, do we have an appreciation for how many people are addicted? And even a bigger pool, how many are at risk of addiction in the community?
As far as, knowing how many people are addicted, I think the general public probably thinks that they know, but they don't. There's so many people out there who are addicted that you would never contemplate being addicted or even just starting into their addiction. And you would never see it, and you don't see it, and you don't see it until it's so far gone that they're gone, they're hard to bring back. So to say that, we know how many, I don't think the general public understands.
I think that we have to appreciate that this problem has taken a long time to get to where we are today. The rooting of this challenge has manifested itself over literally decades. And so we have to understand that however we approach this, unfortunately, it's going to take time and effort and resources to start to unwind that process. One of the things Chad mentioned was that we were down the other day at the Stabilization Center, and I've been down there since we started the construction of it. But the thing that struck me the most about the other day was the people that I met, and they look just like us. They're young, they're female, they're male, they're old. Some have obviously other challenges. But any notion that you have of what an active opiate user looks like, I would say yes, and I would say you're wrong. It is a tremendous diverse. We have impaired professionals that are actively in treatment because they had access to opiates. So please always go into this with an open mind. It's just not a person who's living down on the streets shooting heroin. These are dentists, they're doctors, young girls of 18 years old, sports injury people. That's why it's imperative, I think, that we develop a community education and prevention strategy. How do we minimize this this volume of people? And it's only through, I think, active engagement as a community that we're going to be able to tackle that challenge.
The outcomes that we've tracked from ASK so far, we know that the split that we've had is 60% men, 40% women. The average age is 25 to 44, although our youngest clients have been 18. We've had clients who have been in their 60s. And so to David's and Tiffany's point, this disease does not discriminate. It's affecting whole families. It's affecting our whole community.
Sean, could you also add on the people you're serving? There has been conversation about people are coming from certain parts of the county, and also any racial breakdowns between African American and white clients that you're serving.
Yeah, the racial breakdown is pretty much split. There's no disparity that's one way or another. We're getting people from the entire state. Ironically, we opened this up, we thought that EMS would be the #1 referral source. That's been slow, but we're working on that.
Right.
Ironically, the large percentage of patients who we've accepted there have been walk-ins. And so it goes to, the word on the street. We didn't want to deal with walk-ins, but it's nice that the word out there is, hey, you can come to a safe place and get immediate access to treatment.
Great, thank you.
I think to that point, too,
Yeah,
just really
please.
quickly, we're not always bringing a lot of people in, but there's been so many people, and we have a team that's dedicated to follow up with those people as well, just letting them know what resources are available. And that team alone has done some great work at getting people that maybe I saw 4 days ago, but they followed up with them, and all it took was somebody saying, hey, we care. We're here to help. There's options.
So hopefully you're gathering from our 3 panelists that we have a large issue still in this community. It is a complicated issue, no easy solution, or else, believe me, we would have all tackled it together. But we're in it together, trying to save lives at the end of the day. And Tiffany, to the point you just made, save lives with compassion, which is a core part of the work that Tiffany and her colleagues do, Sean and his team, and David and all the agencies and hospital systems serving people today. But it's a big pipeline of individuals who are addicted, have OD'd, or might be at threat. So again, the education and awareness campaign of Denial Ohio is really focused on preventing the next generation of addicts in our community. We realize collectively that it will not happen overnight either, but the beauty of having an alliance with so many robust, thoughtful organizations working in this direction together is we're committed to trying to make a difference and really to, again, prevent the next generation of addicts. So I'm curious, Sean and Tiffany, as you are engaged with your work each and every day, of course it'd be great to see fewer people, but what does a prevention campaign effort like this mean to you? Tiffany, you want to start?
For me, just first off, as a mom, it means we're getting something out to the younger generation. You know, unfortunately, sometimes I feel like we're losing a whole generation of people to this disease, to this drug, and so educating parents and educating kids earlier, sooner, as to the, you know, how to dispose of their drugs, how to treat the drugs if your kid would get prescribed it for an accident or those kinds of things, how to recognize, you know, if there is a problem, means the world. Because yeah, if we could just stop seeing this, that would be amazing, especially for young people. I don't like bringing back young people.
It means a lot to us because unfortunately there's still a great deal of stigma that's related to this disease. We don't treat this disease like normal diseases that we encourage people to go get treatment for, and we're supportive. And so the more forums that we can have like this, the more videos and the more education that we can do may lead to Tiffany's point of not bringing in kids. I think the prevention side on a younger age needs to happen earlier. We've got to get into the schools. That's great that we provide immediate access on South High Street to a 25-year-old, but there's a lot of things that went on in that 25-year-old's life before they came to us. And so the prevention and education, and the more we can break down this stigma, I think is critically important.
Great, thank you. So the Denial Ohio campaign was developed over about 9 months with significant research going into the campaign effort. David mentioned the scanning the country to see what other communities are doing. I think there were 30-some campaigns in other cities that we found. Most were testimonial or scare tactic. I believe one, David even said, "Don't die," was the theme of the campaign. So as part of the campaign preparation and creative development, we did many focus groups and quantitative research or survey work. Then we went back with the Adam Age team and actually asked parents of children who are addicts to sit with us, look at the creative, to ensure, one, that it was on point with them and was not pointing fingers at them. So it was pretty amazing, the feedback that all the focus groups and the research gave us, but in particular, that group of people. David, can you speak to some of the feedback that we received from the families?
Yeah, we went through a process where we just had very individual interviews with these folks. One actually had lost a child to an overdose. And the thing that ended up happening was they said, "I wish this campaign would have been there for me. I didn't realize how much in denial I was through this process." And it was extremely, obviously, emotional and powerful, personal. And we actually ended up using a lot of what we heard through those conversations so that when you see these scripts on television or radio or digital space, these are really conversations about parents that have experienced this. What we ended up finding, though, that was very interesting was that there was there's a very large disconnect when you talk about opiates. The current state is, I know it's a crisis, I know it's an epidemic, but I also know that it won't affect me. And what was interesting about that is that when we looked at the research, the percentage of people that believed it was going to potentially impact their family was about as high as you believe that you're going to have a family member involved in an airplane crash. That's how much functional denial there is out there, that it's not, you know, that it won't happen to me, it's going to happen to them, and them, but not me. And so one of the things that we went through this process, we realized that's what we have to change. We have to change the mindset that it's someone else, it can't happen to my family, can happen to my relative, to it can happen to my relative, and what can I do to change the probabilities that my relative or my loved one will be impacted by this crisis?
Thank you. So David, follow up on that. What are the outcomes of the campaign or the call to action for people? Tiffany actually just touched on one as a parent of what you can do, but if you could talk about that and share with folks what is also at their play setting.
Yeah, at the end of the day, what we kind of coalesced around two concepts. We know that talking to your children actually works. It's maybe not the most pleasant conversation to have with your child, but it actually works. If you can talk to them about the risks associated with it, you'll decrease their risk. The other thing that we found is that the campaign also talks about denying that me storing my leftover prescriptions in my medicine cabinet presents a risk to my family. And so it's about drug disposal. How do we get rid of what I term as the passive supply of opiates that tend to be in homes from when you sprained your ankle but you didn't finish the script? The bag that you have is a biodegradable bag where you simply put an opiate that you find in your medicine cabinet that's outdated, or you think it's outdated, or you've quit taking it, and you properly dispose of it. It's an environmentally friendly bag, and it just has a small amount of biomass. It'll give you instructions. You add a half cup of warm water. Believe it or not, that's an effective preventative strategy, because most kids and most people actually start from prescribed opiates. One of the other interesting things that has occurred in conversations with people about this subject is that when you ask them and they say, well, you know, I actually went through it and I found I had a prescription of Percocet that was a year old when I did this or that. And you say, well, why did you keep it? And they said, I might need it. Well, what we're trying to do is educate people to the fact that it's okay to dispose of it, because if you need it, someone will prescribe it for you. You don't need to keep it. You will decrease your family's risk if you simply dispose. If you talk to your children, again, it has an impact. So we kind of coalesced around, I think, these two critical concepts. Decrease the passive supply, engage families in conversation, and maybe we can stop the flow of people that start, given the fact that we know so many people that become heroin addicts or active opiate users actually start from what we know is a passive supply.
So this is the bag. Hopefully everybody's familiar with it. So I've been surprised at times in talking to leaders around the community about proper disposal of prescription meds, how folks are on the issue, they're aware of it, they know they shouldn't keep these medicines in their medicine cabinet, and 3 or 4 times I've heard, and so I flushed them down the toilet. That's not the proper way to do it, so David and Sean and Tiffany, I'm sure, would be on page with that. There are drop-off locations frequently around the community, usually public sector locations of fire stations, police offices, but this is an easy, effective way to do it. My colleagues at Nationwide have been distributing these bags for quite some time now, and it's been a very safe, effective way to dispose of medicine and really take this supply out of the marketplace going forward. Please.
Just to add on, one of the other hallmarks of the campaign that you'll be hopefully immersed in is that it drives you to a website, don'tliveinDenial.org. And on that website, what you'll find is tips on how do I talk to my children, where do I dispose of medicines that I want to get rid of, and they're actually built into this web page search engines that will allow you then to find the information, the tips, the advice, the locations that will allow you to become an active supporter in our community education and prevention initiatives.
Yeah, it's a great call out. So as David mentioned, on the site, don'tliveinDenial.org, there are helpful hints that are research-based through the Partnership for Drug-Free Kids on how to talk to children at different ages. It's one conversation with a 10-year-old, different conversation with an 18-year-old. So that is part of the site, as is the search engine through the U.S. Pharmacy Board on just entering your zip code, and it lists the drop-off locations. The reason the site is designed that way is because although the leadership impetus happens in Franklin County, the media campaign will essentially go to the eastern boundary of Ohio all the way down to the Ohio River and cover all the Appalachian counties. So as we're on air with radio, TV, social media, other outlets, we wanted to ensure that whoever saw the messages had the resources available to them. So we're getting close to our time for questions. So if you have a question, we'd love to hear it for Tiffany, Sean, and David. I will put the editorial in of questions are statements that end with a question mark. Statements do not have a question mark at the end. So please hold to questions in a few minutes here when we have that opportunity. If you have a statement, input you'd like to provide, we nominated David Royer as being the individual who will take all questions afterwards, and I am kind of kidding about that, but that's how it worked out. So before we get to Q&A, why don't we ask the panelists to share final thoughts about our conversation today and anything else on mind that wasn't covered. Tiffany, you want to kick us off?
Just trying to hit on the whole Denial Ohio thing, going back to the father-daughter that we had a few days ago. The mother was so distraught that we even thought about using naloxone on him and yelled at us saying, "That's not going to work, that's not going to work, help him, help him." And so she had no clue. And he was so far into his addiction that he had gone from the pain medications to using his daughter's heroin that he had found and then them using together. Distraught enough that we ended up finding counseling for her that evening as well. So the idea that it's not going to hit home for you, it's going to at some point. Someone you know somewhere has someone in their life that's an addict.
So Tiffany, did the wife not know that he had an addiction issue?
No, she knew he had pain medications because of
Okay.
all the injuries he'd had, but that was it. She thought he had anxiety and that he was taking too many Xanax and that kind of thing.
Okay.
But yeah, she had no idea that he had moved into harder medications.
So within the household, a sense of denial?
Very much so.
Okay.
Very much so.
Sean?
I would just like to state thank you all for being here today. That means that you care about this issue. Ordinary people can do extraordinary things. And I was recently out to lunch with some board members, and the waiter came up and said, "Are you with Maryhaven?" And I got board members with me, and I'm like, "Oh my gosh, what's going to happen?" Some tough board members at that. And so I reluctantly said yes, and he said, "Thank you for saving my life 8 years ago." And so everybody in this room, to the points earlier, this can affect us all, and you never know when it's going to hit, and it's a very complex issue, but don't think that you can't do extraordinary things.
Yeah, real quickly, at your table, you actually have a list of the members of the Ohio Opioid Education Alliance. This alliance is a voluntary organization of both corporate, public, and nonprofit sectors that are coming together to support the campaign, in some cases financially support the campaign. Nationwide Foundation was incredibly generous with a $2 million gift to jumpstart this campaign. We're continuing to look for members to the alliance. We're looking for financial support for the alliance. The public sector needs to step up as part of this campaign. We don't envision this as a one-and-done campaign. We envision this to be a multi-year campaign and a multi-year strategy. If you go back to the idea that we spun this thing up over decades, we're going to have to continue at all levels of our community. So whether it's amplifying the messages that you heard today, taking direct action as a citizen that cares about the quality of your community, we'd ask for your support and participation.
Great. Thank you very much to our panelists. Let's give them a round of applause. So we have a line that has formed at the microphone, and everybody in the room knows where the mic is, so I didn't have to identify that location. So if you could please share your name, and if you'd like, organization affiliation, and ask your question, please.
Thank you. My name is Ann Hughes, and I'm wondering how you're partnering with physicians around this effort, and particularly the prescribing of drugs without considering alternatives in terms of pain management, and also the overprescription by the number of pills that are prescribed.
You know, I want to give credit to the governor and the legislature. I think one of the things that they recognized early on as a strategy was that we needed to rethink about prescription processes. So I think over time what we're going to see, and if you've had a family member that's required some pain medication, it's much more stringent as part of that process. Just as a side, I think the other thing is that we're starting to learn alternatives to opiate prescription. I was having a conversation with an oral surgeon the other day about this issue, and he mentioned that there's new medications now that are non-narcotic that will numb the pain for 48 hours through that first initial surge of pain, where then he only has to prescribe Tylenol or Advil. These are I think, as we continue to make medicine advances in pharmaceuticals and medicine, I think we'll see progress in this area. At the end of the day, you only need it when you need it, and I think with the prescription guidelines that are out there increasingly in the medical community, we'll continue to see progress made.
I would also add that as you look at the Alliance listing, all 4 of our healthcare systems, Mount Carmel, Ohio Health, Ohio State, and Nationwide Children's, are part of the work, and some of the first adopters of wanting to be part of this campaign effort. Next question, please.
You stole my question. My son had oral surgery, he had his wisdom teeth out, and he had 30 days of Percocet and 2 refills. And so I'm glad to hear that there's something being done about that, so thank you.
I can't refer you to this gentleman's practice, but if I could, I would.
Hi, my name's Marie Trudeau. I'm with W.E. Davis Insurance, and thank you for being here. Back when the ACA was passed, Obamacare, a feature that didn't get much attention was that mental health would be treated as any other illness, so insurance companies could not put limits on mental health treatment. Do you find that that's helpful, that you get someone in treatment and if they have insurance, they're going to be covered? Thank you.
I think the most significant that I've seen has been the Medicaid expansion. It's covered a lot of lives, that both from a behavioral health perspective, mental health perspective, but I think it does another important thing that we sometimes don't pay as much attention to, is it accesses primary care. That has, between the two, has an important impact into the quality of life and the health trajectory, frankly, of many people that otherwise do not engage in health care, and then the costs of that health care only accelerate over time.
And the only thing that I would add is it's helped tremendously, because what we do realize is that the patients who we serve have multifaceted issues. They're not just coming to us with substance abuse issues. A lot of times, in most cases, they might have mental health issues as well.
Thank you. Eric Brown, currently a member of the Columbus School Board, and I do agree that we need to get schools and our kids more involved in receiving this kind of education. I commend the work that you're all doing. I've got 2 questions. First, I know a lot of patients for whom opioids are the only or the best legitimate source of treatment. And there are uses that are very legitimate. Many of the changes from the state and from elsewhere have really gotten in the way. The new prescribing rules, for example, where somebody who's using these kinds of medications on a longer-term use needs to go get it filled weekly. Yes. That's just terrible, especially for somebody who has intractable pain and isn't able to do that as easily as many other people. How do you avoid the rules and regulations and the approach that you're talking about? How do you avoid that getting in the way of those patients for whom opioids are legitimate treatment? The second question is quick, and that is, how do you measure success? How are you going to be evaluating your work? Thank you.
I'll let you answer the state thing. You're closer to retirement than I am.
I always try to, and I'm actually going to speak from personal experience about this issue of pain medication and access to pain medication. I've had a family member that has gone through an extraordinary journey, and one of the things that I've learned from this about the prescribing issue is I try not to confuse inconvenience with hardship. It is inconvenient as a family member to have to keep going back and back and back and back. I'm not going to deny that. But it's not a hardship because at the end of the day, my family member had access to the appropriate medications. And so would it be more convenient? Yes. Would it be easier? Yes. Would it be less stress? Yes. But in the end, because of the business I'm in, I'm much more sensitized that I would rather have a person inconvenienced than have excess opiate medication sitting in medicine cabinets around our community. And I'm only speaking for myself, my own personal journey and my own personal experiences. That's the way I chose to look at it. I don't know if that's helpful to someone else.
Sean, would you like to add to that after your cop-out comment?
Yeah. I'll deal with the success, what it looks like for us. As I mentioned earlier in my comments, about 6 months ago, all you ever heard was there were no treatment beds. And the grim reality of when there are no treatment beds, people are dying. And so when we would get a call, say, hey, I'm ready to get treatment, and we would have to say, well, we don't have a bed for you, we wouldn't see the person again. Now that sounds very grim, but that was the realities in which we were dealing with. So for success for us, we realized that the stabilization center probably isn't going to make the desk go down or those type of things. But success for us looks like we have a treatment bed for when these people are ready to receive treatment. We got to be there ready for them when they make that decision.
So I'll quickly address Eric's question around the campaign. So one metric would be that we have a prevention campaign because the work on the treatment, recovery, counseling is so onerous, so challenging, and needs to continue, but we've got to figure out a way to stem the pipeline in some way. Once we have the campaign launch, which we did about a month ago, we're going to track engagement with the site. We're going to work with all the members of the Alliance to utilize their networks to reach their employees, their members, their clients, whomever is appropriate, with prevention messaging. Then over the course of time, we want to track, as David was talking about earlier, has the mindset shifted from it's somebody else's problem to a sense of it can happen to any of us. Next question, please.
I'm Carol Looper. I'm a retired news reporter, but I'm still a news watcher. And in the news the past several days has been the story of Demi Lovato, who allegedly, to her fans, kicked her habits and was clean and sober. And yet she was found unconscious. They treated her with Narcan, and she is recovering. What kind of an effect does somebody who is a role model for young people have when this kind of story comes out?
I'll speak to that just a little bit. Yes, it can make it look like there's no hope because she can't get clean. But what the other side of that coin is for the people who have relapsed and have tried to go back to see that it happens to just about everybody, if I'm correct. I get a lot of people in the back of my medic that are crying and upset at themselves because they've been clean for 6 months, a year, 2 years, and they relapsed. Most addicts relapse several times, as I understand. I don't know the numbers exactly. So while it can be bad for some people, for other people, it's actually a ray of hope that, okay, she did it too, I can get back into it.
Sean or David, would you like to add?
I think it's just important to remember that it is a chronic relapsable disease, and this addiction in particular, I think, is one of the most brutal addictions that one can have, because it is so hard of a journey to recover.
I agree with those comments. I think each case, although very, individualized, we've seen 8 to 9 times before they finally are on the road to full recovery.
And also, I think it's an addiction that kind of sneaks up on people.
Yeah.
It really is. They think they're doing fine, and then all of a sudden, they can't do without it.
Next question.
Hi, my name is Jessica Brown. I'm with Action for Children, and my question is about the supply side. We often talk about the demand side. I think it's because that's so accessible and so immediate. But I'm curious about, and I've heard a little bit about the supply side, especially considering things like availability of heroin and potency and how that's changed, how that impacts the crisis, and what role, if any, a campaign like this might play.
Well, there's a couple ways that I look at it. One is there is litigation at the federal level in regards to the supply side issues, and that process will work its way through the courts. But I think there's also just a collective, and this is probably the most important thing, a collective awareness about both supply and demand. And that transcends through the medical community, the professional community, the pharmaceutical segments. So I think it's permeating through every segment of our healthcare economy. And that's that inching up of awareness and thoughtfulness about the issue on the supply side.
Sean or Tiffany?
To kind of go back to a question earlier with regards to it making it difficult to get the opiates prescribed to you, the one thing that I have seen a lot more of, I think, is the people who were on prescribed medication. It got harder for them, and that's when they turned to the street, where that supply is now getting, for lack of better terms, better, quicker. But if there's an upside to that, that's where I get to see them. That's where I get a hold of them, and then I can push them into the resources that they may not even realize that they needed, because before it's my prescription. So we're kind of stopping the supply on that side. We've got another supply, but it's illegal, and it's got people on the front lines grabbing people out of it.
And, I can just generally speak to that when you work and have conversations and meet with law enforcement, especially as it relates to undercover operations, the degree of sophistication that we're able to apply now through different strategies. Most people have cell phones. Well, addicts have cell phones, dealers have cell phones. There's a lot of innovative strategies that allow us to look at the issues of overdose and better inform us as to how to intervene on a supply side, on the illegal supply side.
Yes, very much so.
Just to put those comments in perspective, I recently had a conversation with one of our patients and said, where do you get it, how much, and how fast? And I was shocked to find out that for $10 in 10 minutes, anywhere in Columbus, you can get heroin. For $10 in 10 minutes.
It can be delivered to you.
Be delivered to you.
Yes.
That quick.
Hi, my name is Selena Fabrizio. I'm with Paul Worth Associates, and I know our firm, our team loves working on the Denial Ohio campaign. I'm actually here for one of my best friends whose 15-year-old daughter has been battling this since she was about 12. And so I texted her, I said, you get one question. I will ask one question for you. And her question was, that what she's found is when she's been referred to a residential treatment program, it's recommended for a certain time period, but then insurance has cut it off after 2 weeks. She's never been able to get the amount of time that she needs. She's moved her from Chicago to here, and it just keeps going. And so what do you do for these adolescents that are getting into this now?
I guess I'm going to have to tackle this state question. Just to be totally honest and transparent, the state of Ohio has not made it easier for us to provide treatment. The example that she just talked about, in almost all of our programs, starting last year, January 1st, and starting July 1st when managed care took over, they have drastically decreased the amount of time that we could treat folks. It's just the stark reality of it. And so what I would tell her, though, is to not give up, keep referring. What makes Columbus great? We're sitting here today, we talk about the Mass Center that we opened. It was a collective collaboration between private and partnership that we raised money and facilitated this place in 6 months. And so hang in there, keep referring. I like to tell people we'll let the state of Ohio thing and the other politics thing settle itself out. We're going to continue to provide treatment. So that would just be the best answer that I would have, just to hang in there and keep referring.
Yeah, I think from a Franklin County perspective, the Adam Board took a strategy that said this is affecting every part of our economy. This is killing people and it's destroying families' lives, and we can't allow insurance to get in the way from providing access to care for these people. And so we've tried to take it from a strategy of, we don't care what form of insurance you have, we're going to underwrite it because we have to stop the deaths, we have to stop these families from losing their family members. Over time, we'll figure this out, we'll work it out, but the Columbus way is collaborate and partner and just tackle the obstacles as you find them, but create solutions that are positive for the community, and that's the way Adam approached this problem.
All right, David, well said. Tiffany, Sean, thank you. That was our final question. Turn it over to Mindy for closing comments.
Well, thank you, speakers. I hope you all found today's forum informative, and I guess for me it was hopeful, too, to see all of these people coming together to work on really hard problems. Let's thank our sponsors, Ohio Health, Mount Carmel Health System, and Cardinal Health. And our speakers, Chad Jester, Sean Holt, David Royer, and Tiffany Page. And thanks to all of you for being here. We look forward to seeing you next Wednesday at CMC, or earlier than that tonight to see Dan Rather.